Welcome back to the Group Practice Accelerator podcast, brought to you by Polaris Healthcare Partners, where we leverage decades of healthcare and business experience to drive growth in successful group practices just like yours. If you're a healthcare entrepreneur and you're interested in building, scaling, or exiting your group practice, you've found not only the industry's leading resource for business education, but a team of trusted advisors dedicated to helping you achieve and exceed your goals. In short, the team at Polaris creates clarity, confidence, and results. I'm your host, Jamie Falash, and the Group Practice Accelerator podcast is on the air. Well, hey, everybody. Thanks for joining me for another episode because I think you're really going to like today's discussion. My guest today is my colleague, Dr. Vivek Solanki, who you've told us you love hearing from. And as a reminder, he's our Director of Clinical Coaching here at Polaris. So I've asked him to come back to dive into something that he's passionate about, and that's growing providers into the powerhouses that they can be within the practice or within your group. So now we hear a lot about consultants out there who want to help you improve. And I don't know about you, but I really want someone who's got expertise that comes from somebody who has that dialed in, meaning they've done it, they've lived it, they've grown their group practice using these exact skills. And B, I want it to come from a doctor who really knows how to communicate and, more importantly, transfer that expertise to you and other providers within your practices so they in turn can each and collectively grow that business, right? So on top of those criteria, it's important that expertise be shared face-to-face, hands-on. You know, as doctors and even as hygienists and clinical learners, we're tactile people. We can't just phone it in. So we need that hands-on learning. I know that for a fact. So those shoulder-to-shoulder techniques in our learning are the most valuable kind, and they ingrain those new tools in a really relatable way, provider to provider. So I could go on, but I want to rope in my guest here. But stay tuned because we'll also be highlighting an opportunity in January to learn live from Dr. Solanki and what he'll cover during the masterclass that you've been hearing about that we're going to hold here at Polaris in Charlotte. I'll link to that in the show notes at the end, but we'll talk about more of that as we go along. Vivek, welcome back to the show.
Hey, Jamie. Great to be here. How are you?
Good. Always good to see your face here.
Thank you. You too.
Well, let's jump into this event. I'm excited to have our guests come and learn from you. We're going to kick it off January 14th with our arrival and networking that evening at the hotel and kind of get to know each other and our sponsors, of course. And then the 15th and 16th, we're really going to dive into that content that's meant to help you grow and achieve certain goals. And Thursday belongs to you. It's kind of your platform where doctors, providers are going to get that experience that you share personally that we all find really valuable, and our listeners who have engaged you also have found really valuable. We want to share that in a broader way. So that's the masterclass, one in our series, in fact, called The Leadership Advantage. So January 14th through 16th. So what I want to do is jump into your content that's really valuable and impactful. And this is also CE, by the way. But we'll start with how your day is going to kick off, and I'll let you take it from there a little bit.
Yeah, I mean, I think it's going to be really exciting. Definitely a lot more time to connect with people, versus email and phone calls. I think over the course of the clinical coaching and the number of people who've reached out to us for advice, they've requested more time to digest the content.
Mm-hmm.
And I love how you said about the consulting. I don't look at myself as a consultant. I mean, I just came from the office right now.
Yeah.
I was in surgery this morning. I was working with my docs, and now I'm here doing this. So I'm a practicing clinician, but the only difference between me and some of the audience is maybe I'm a few steps ahead of where they want to go, or I've experienced some of the things that they are having challenges with. My platform and what I do is as a periodontist is a little bit unique because I look at things from a different set of lenses. I look at a dental office and I think free EBITDA, right? And somebody would say, like, how is that possible? Because I'm thinking about the things that are already in there that we can help with the patient pool, get people healthy. What can we do to grow? And a lot of people have asked me so many questions, from how do we get our docs to do a certain production amount per day? And usually it's a number that they're looking for, but the conversation then moves because we're clinicians talking to each other. The conversation moves to like, what type of dentistry are you guys doing in the office? You
Mhm.
know, and how are you treatment planning? Are you excited doing this type of dentistry? What payer groups do you have in your office? There's so many factors that dictate this, and often what I find is that people are actually excited to do better quality dentistry, things that are more fun and more challenging, more impactful to changing patients' lives. But the fear of unknown, right? And the fear of traveling places they haven't gone before stops them, and they get stuck in this comfortability zone and they can't change. And it becomes hard when they have associates, multiple locations, more than one, and they have goals not only from the clinical side, but also from their business side, because they want their business to get in a certain, they want it to go in a certain direction. They want to meet certain goals that they've set out for themselves.
Yeah, and I'm glad that you brought up that fear because I want to touch on that really quickly here. That there's a little bit of vulnerability. Like you're not admitting that you're not doing well. That's not the point. It's admitting that you want more, and that's okay.
Hmm.
So
Hmm.
yeah, sometimes there is a little bit of fear with branching out and
Hmm.
taking a little bit of what you might feel is a risk, but truly, where's the risk in learning more and engaging with your peers and collaborating on the things that might be possible for you, not only as a provider, but for your business, regardless of who you
100%.
are, whether you're an owner, associate, partner, no, it doesn't matter who you are in that business. I think there's always potential for us to grow.
Yeah, and I ask this to our audience, our listeners, right? If we all as clinicians went to a full arch conference, right? And we went to a full arch conference on how to adopt a digital workflow for All on X, how to incorporate pterygoids, zygos, volatile approach so that we don't have to turn cases away. Everybody that's a clinician knows kind of what I'm talking about.
Yeah.
We would go there and we would be able to learn certain things in that conversation to take away and say, tomorrow I'm going to do these surgeries different. I'm going to do these conversions different. I'm going to get people into zirconias a little bit faster. There's so many things that we could take away from like a clinical meeting. But then what what baffles me, and it just blows my mind, is that some of the principals and people who are running dental offices, they want their businesses to go in a certain direction, but they're not willing to do the necessary things to help the clinical outcomes in their businesses get better, which
Mhm.
is what are your what are your team members doing? Have you listened to your doctors talk to patients? Have you seen them treatment plan? There's a difference why you're a super producer and then there's a massive gap. Like you're never going to get somebody to be 100% of you. But if
No.
somebody is trending to 70, 80%, then you've done a really good job and there's room for them to grow. So we're really going to look at this from a macro level to start off. It is a clinical approach to this, right? But the goal here is like, how do you ethically grow a business by looking at things from a clinical scope? And we'll start with the building blocks. Like, what are the doctors doing that are associate doctors in the practice? How are they talking to patients? How are they treatment planning? And what are some steps and drills and things that we can take that I use to help them grow? And then you may have a group that's very happy with that outcome. You may have a group that has doctors who are doing very well. You know, I met with no names here, but I met with some clients who have great GPs in a very large group practice setting, but they have no clue on how to bring specialty in, and they are somewhat hesitant to it because maybe they had um, a bad or an uncomfortable outcome with it and it didn't go as planned in the beginning. So
Ah,
we then look at group practice as well, because that's what I'm running now, where we have the GPs who are doing what they're doing. They're super GPs, or maybe they're placing implants and doing some surgeries, but there's no animosity when the specialist comes in and the GP is there. There is camaraderie. There is, hey, these are my cases, and the specialist is cheering you on. Like, good for you. You're doing these cases. Fantastic. The GPs know what they can do and what they can't do. So patients still get the best care. You have GPs collaborating with specialists. Now you have a multi specialty approach. How do you implement that? how do you build their schedules, and then how do you keep it going? And people want to learn that stuff because it is truthfully that's where the industry is going. Patients don't want to leave and go to 50 other offices to find their care. They want it done in
No.
one place.
Yeah, you're absolutely right. And you mentioned building a foundation. So why don't we start with that? Because that foundation really is where this has to start in terms of that camaraderie and bringing in specialty. So your first segment is called Start Smart. We're going to be talking about your experience. Can you elaborate a little bit on that? Because I know it speaks to that strong foundation. I know it talks about your journey from GP to multi-specialty. Can you give us a little preview on that?
Yeah, I started out as a traveling periodontist, so I had access to look at so many different business models from large multi-billion-dollar corporations where you traveled to one office to the other, working in solo specialty, working in a small GP practice, and then working in group practice. So there are commonalities, and there are things that are very similar across all of the platforms. But if a consultant or if a trainer or a teacher only has access to one set of materials, everything they teach is going to be a one size fits all. And
Yeah.
that's not what this is about. Everybody's business is different. They run their hygiene schedules different. They run their new patient flows different. They treatment plan different. And there's no right or wrong way, but there are best practice to succeed. So starting smart is really learning that there's so many ways to do it. Here's my failures, and these are the things that have taught me to become better and to become successful as a group practice owner. And how do we basically set up foundations for a basic GP office or an associate driven GP practice to start off to be on the strong step moving forward, meaning clinical dentistry outcomes are satisfactory, they're exciting, they're creating some sort of good culture in the office where doctors and people are excited to come to work. Like those are the foundational blocks there. And it's very simple steps to do, but it's taking the approach from a clinical lens and clinical onset.
Yeah, that makes sense. And you mentioned that journey and how that was for you. Again, I'll go back to what you just said about consultants. And listen to our audience, we're not digging on consultants here. There are plenty of wonderful consultants out there, but this is very different. When it comes to growing your business from a leadership development, from a clinical development, from a doctor development, you want somebody who has lived and breathed this and done it successfully and knows how to teach the right skill sets, how to communicate the right skill sets so that they become ingrained in your people and ingrained in your business, if that makes sense.
Agreed.
So we're going to jump to your next session, which is called Unlocking 5K a Day. So we're integrating this course that you're going to present your expertise again. But of course, there are plenty of people out there that can hit much more than that. So it's about developing and meeting you where you are. So this is a great benchmark, but we know there are people out there that already exceed that can still benefit from this. Does that sound right?
Absolutely, absolutely. I think the best way to look at it is, us as docs and the clinical side, especially with hygiene, we all have a toolbox. And
Hmm.
what are those clinical outcomes that we can do in our toolbox? And as a periodontist, I guess I'm more closely attached to the GP side of things because a lot of what we do relies on each other. So I've for me personally, there's a lot of GPs who are more forward thinking. They're doing more implants, they're doing more full arch, they're doing advanced clinical cases, which is fantastic. I think it's amazing. But there's also a large subset of general dentists who are very, very basic, where they're still sending out exografts, extraction grafts, single implants, which they could be doing, and they have a desire to do it.
Yeah.
So unlocking the 5K a day is understanding where doctors are at and what are the things that we are able to, as providers, we are able to help them develop and implement into their treatment planning and execution playbooks that it's safe to do. And it's going to adjunct their restorative dentistry. Notice that I said adjunct. We're not trying to take a general dentist away from doing fillings and crowns and just you're my on-site GP endo. You do molar endo. It's something that they are going to be able to say, like, this is something I can handle and it makes sense as a part of my treatment plan. And the patient's going to be numb here, so I might as well do it. And it's also going to be efficient for the patient. These are things that are going to help build their production outcomes in the office, but it's also going to be like a one stone, four birds. It's also going to be fun for the doctors because they're going to be learning and growing. It's going to be productive for the practice, and patients are going to appreciate it even more because they're going to be able to get so much more done in one visit than to come back to the office like 6 times. They don't want to do this stuff.
Yeah.
So unlocking the 5K day is starting there and getting people to understand and look at their doctors and look at their clinical outcomes in a different way. And that's how you get to 5 and you exceed 5 very easily.
Well, and you mentioned consistency. Without that, what do you have really? And that applies to some other things that we're going to be talking about at the masterclass on Friday in terms of operations. And then at lunchtime on Thursday, Carrie Smith, co-founder and CEO of Dundesk, is going to be presenting on that sort of task management and operations side of it, because all of that consistency that you mentioned has to come also from the harmony of your team working together. So I don't want to discount that.
Absolutely.
That's really a critical piece. Now, your next segment after lunch speaks to case acceptance. Now, I think that there's, from my personal experience and what I've heard people talking about, I think people usually feel that their case acceptance is pretty good, but I think sometimes the numbers don't agree. Sound accurate?
Yeah, because when we ask our doctors, oh, how was your case? Oh, yeah, it was great. Treatment plan was great.
100%.
And then we look at the schedule. Did this patient make it on your schedule? Is it a deposit? Are they ready to go? Oh, no.
Mm,
So, case acceptance is a team thing in the office.
sure.
It starts with the doctors, speaking to patients and helping them understand what's needed to be done, the why, and then a real call to action, which many providers are afraid to say because they're just not comfortable doing it. And then administratively, what are the things that need to happen with your team to mirror what happened in the clinical consult so that these patients do make it on the schedule with deposits so we don't have no shows in the schedule.
Hmm.
So it's a twofold way. How do we do that and make it harmonious so that patients don't feel like they're a number in the practice? Like they leave saying, this was nice. Like I didn't have to be a doctor in here. Like I could just come in here. I could get told what my problems were. I trusted them. They made it easy. I got my deposit and I'm scheduled. And that could be for a crown and a filling right next to each other, or that could be a double arch, full arch that needs to be done next week. It's the same concepts, whether it's $50 or $100 or 40K, 50K.
Yeah. Yeah. It's that repeatable process that we just talked about, right? Consistency. Same
Mhm.
way every time. If the patient canceled, let's work together to get them rescheduled and get the case closed. But yeah, it's a
Sure.
collaborative effort for sure, and it's case acceptance can always be better.
Yeah, absolutely. You find that the doctors will learn a lot more. When we focus on this section and we give them drills and tools, things to do amongst their team,
Hmm.
they'll organically see that case acceptance continue to grow over time. It's not going to go from like 20 to 100%. But as they learn more about their systems, they'll get better. They'll keep doing those drills that we teach them.
Yeah, absolutely. All right. So your next session is about elevating care and really inspiring that change. Can you tell us a little bit about what that means?
When teaching associate doctors or younger doctors, the fear of making mistakes and messing up or doing things that are not being done routinely in their clinical set is often going to be the biggest barriers. So, how do you support them and create an environment where you get them from your it's like suctioning or your chair side with them to then you're watching them, and that's really where you're going to kind of inspire them and give them that confidence. And there's an art form to that, because you can sometimes do too much and push them the wrong way,
Ah,
but there's an art form where you want to kind of let them know that you're always there to catch them if they fall, but you're still going to let them fall. And in patient care, no patient's going to get an adverse outcome. But you, the principals or the coaches or whoever's going in to drive the ship, they have to set this new standard of care. And then they have to build this ecosystem about this is how we're going to train to do this, and this is what support you're going to get. And then this is how we're going to do these cases together, and these are how we're going to measure your outcomes. And you see small wins start adding up, and eventually you see the docs just coasting on their own.
All right. So we're going to move on to that specialty part that we kind of touched on from your morning session. Strength and specialty, which is the session that follows, is something that is going to explore why starting with a periodontist or another specialist can unlock some exponential growth, right? Or some hidden
Right.
growth you may have. Tell us a little bit about that.
I'm a little biased being a periodontist myself, but
Maybe.
you know, every specialist is going to see something different in a practice. In a strong GP office with 4 hygiene running schedules every day, that's music to our ears in perio, because every practice has a percentage of ongoing perio disease in it. And it is not because of neglect on the GP side or the team side. Is sometimes that patients don't want to leave. So what other outcomes do they have in the practice? We just keep doing perio maintenance, right? But where the industry is moving and where group practice is growing so much, there are ways to bring in specialty 1 to 2 days, maybe even 3 days, 4 days a month, and you can develop a program to get your patients healthy, to minimize the perio that's in your practice, free EBITDA in the practice, right? I don't know why anybody wouldn't do this, because you're not necessarily cannibalizing your patient pool. You can always have patients come in from outside of the community, but there's so many patients already in a practice. You can bring people in, and we start with perio because it's the foundation of what we build on restoratively.
Yeah.
And we can work with hygiene. So not only are your hygiene teams going to have like this breath of fresh air, like, okay, great, I don't have to watch these sixes turn into nines and eventually become EXTs in my tenure here at the practice. We have a way to get these people healthy. And we have somebody who's going to talk to them and encourage the importance of getting these procedures done, definitive periodontal therapy. And then we put them back into hygiene for these PMTs, which are going to be easy for hygiene to do. What does that add? Just think about this: 2 days a month of perio, and average daily production for perio is 10 to 12K a day.
Mm-hmm.
That's what, an extra $250,000 a year
Yeah.
of perio services. Users and listeners, like, do the math. But what are
Exactly.
we doing? Are we going and chasing money? No, we're minimizing perio disease in a practice and keeping people healthy.
Yeah. And you're retaining the patient within the practice and getting better outcomes for your restorative
Exactly.
side. Well, absolutely.
And every practice is different. You may start with OMFS first. Depends
Yeah.
on what the referral models are. And that's why it's great to understand where our audience is coming from, what they have, and then how to map out which specialties to bring in, why, how, and what to do next.
I love that you've already broken down, I'm sure, some resistance to that just with that short preview, but we'll get a lot further into it, of course, during the masterclass. So I'm excited to see how that's received. I think it'll be eye-opening for a lot of people.
Absolutely.
All right. And then we're going to wrap up that day, before dinner. Your last session talks about building momentum, because now we've got a bunch of pieces that we've got to bring together, because we want you going back to your practice Monday morning and using this, not just going home with, a notebook and some things you jotted down. These are tools that you should be able to integrate and implement day one. So let's talk a little bit about that momentum and how those pieces are going to work together.
Sure. These classes are designed to be a little bit more intimate. So there's Q&A. It's helpful. It's encouraging. Other audience members may ask questions that may benefit so many other people in the audience. You're going to get a laundry list of things that you can implement just based on the questions that you're going to ask, and talking about your workflows and learning from other people and kind of actionable items. The same thing we would do if we went to a clinical course, right? Like, I'm going to do this for full arch next. I'm going to implement this. I'm going to look at this implant system because of these reasons. That's what the building the momentum is, to give people actionable items to go home with and start implementing into their own organizations. And hopefully it gives them the lift and that they're looking for. And it's fun. And hopefully it's fun for them.
Absolutely. And you're providing so many aspects of doctor development in one day that will kind of spill over into the topics for the next day. So I'm super excited for this. I'm really glad that you brought up the fact that this is an intimate event. This is not going to be in some giant ballroom. This is meant to
Hmm.
be smaller scale. You can raise your hand, you can ask questions. There's tons of time for one-on-one discussions and Q&A. So make sure you register and take advantage of that, because it's really meant to develop you. And I just mentioned our Friday sessions. Our fractional COO executive is going to be presenting on solving for scale, but going back to those foundational elements that Dr. Solanki presented on Thursday. And the same for our partnership strategies executive, Mark Flock, who's going to be presenting on partnerships on Friday as well. And all that ties into retaining people within your practice, growing people within your practice, and growing the business at the end of the day.
Hmm.
So we're really excited for all those presentations, and I know we're looking forward to seeing you in the middle of January in Charlotte. I will put a link to the event in the show notes, but we want to thank you for coming on here today and giving us a little sneak peek. I know I'm excited about it.
Thank you so much, Jamie. Looking forward to it.
Well, good. To our audience, don't forget to register. I'll put that link in the show notes, like I mentioned. And once you complete your team's registration, you will get an email that includes the hotel room block info. So make sure you grab your room before they fill up. And to all of you listening today, we appreciate all the support that you give to us by subscribing, sending us your comments, sending us your ideas. We love the questions, so just keep them coming. As always, if you want to learn about any of our Polaris expert advisory services, and again, if there's a topic we haven't covered that you want to hear about, please send us an email to info@polarishealthcarepartners.com, or you can reach us by visiting our website. Go up to that Contact Us button at polarishealthcarepartners.com. Thanks so much again for being a loyal listener and subscriber. If you enjoyed today's episode, please share it with a colleague and be sure to leave us a rating on any of your favorite podcast platforms. We'll see you on the next episode of the Group Practice Accelerator Podcast.